Cirrhosis of the liver. Cirrhosis is a condition where liver tissue becomes permanently damaged and turns into scar tissue. The main causes usually come from long-term liver injury, such as excessive alcohol use or chronic infections from hepatitis B or C that have been present for many years. More than 1 million deaths per year are caused by cirrhosis. In decompensated cirrhosis, the mortality rate reaches 50% within 5 years after diagnosis. Symptoms often appear only after many years, including yellowing of the skin and eyes, weight loss, and abdominal swelling due to fluid buildup. Modern treatment includes liver transplantation, which increases the 5-year survival rate to 75 to 85%. End-stage heart failure. The mortality rate for end-stage heart failure reaches 50 to 60% within just 1 year. This condition occurs when the heart muscle can no longer pump blood effectively. At this stage, the damage to the heart is severe and permanent, making it unable to meet the body's need for oxygen and nutrients. Common causes include long-term heart disease such as repeated heart attacks, uncontrolled high blood pressure, or chronic valve disorders. Symptoms often include shortness of breath even at rest, swelling in the legs, and fluid buildup in the lungs and abdomen. Modern therapy offers options such as mechanical heart pump devices and heart transplantation, both of which can significantly improve life expectancy and overall quality of life. Idiopathic pulmonary fibrosis. Idiopathic pulmonary fibrosis is a chronic lung disease in which the lung tissue thickens and turns into scar tissue without a known cause. This damage makes the lungs lose their elasticity, causing a drastic decline in their ability to absorb oxygen. The disease progresses slowly but steadily, with a mortality rate of 65% and an average life expectancy of only 3 to 5 years after diagnosis. Symptoms often appear gradually, such as shortness of breath during light activity, a persistent dry cough, weight loss, and clubbing at the fingertips. There is still no cure that can completely stop the fibrosis, but modern treatments like pirfenidone and nintedanib can slow down the progression. In severe cases, a lung transplant becomes the only option that can improve survival. End-stage kidney cancer. End-stage kidney cancer is a condition in which cancer cells have already spread to other organs, such as the lungs, bones, liver, or lymph nodes. The main cause still comes from genetic mutations in kidney cells that develop over many years, worsened by factors like smoking, obesity, and high blood pressure. The mortality rate reaches 70% based on 5-year survival statistics. Common symptoms include persistent lower back pain, severe weight loss, and bone pain. Treatment at this stage focuses on extending life and controlling cancer growth. In a small number of patients, a strong response to immunotherapy can slow disease progression and improve quality of life, although the chances of a full cure remain low. Rabies. Rabies is a severe condition that occurs when the central nervous system becomes heavily damaged and can no longer return to normal function. The disease is typically caused by a rabies virus infection from the bite of an infected animal, progressing gradually until it triggers intense inflammation in the brain. The recovery rate is extremely low because there is no effective treatment once symptoms appear, with a mortality rate of 80 to 100%. The only truly effective medical intervention must be given immediately after the bite. Rabies causes an estimated 70,000 deaths per year worldwide. Creutzfeldt-Jakob disease. Creutzfeldt-Jakob disease is a condition marked by progressive brain damage caused by the buildup of abnormal prion proteins. The main cause is prion misfolding, which triggers rapid death of brain cells and leads to a drastic decline in thinking ability, movement, and behavior. Common symptoms include memory loss and a rapid decline in cognitive function. The disease can lead to severe dementia, paralysis, and eventually death. The mortality rate for CJD is extremely high. Over 85 to 90% of patients die within 1 year of the first symptoms appearing, and most experience a rapid decline with no stable phase. Huntington. Huntington's disease begins with changes that often go unnoticed. Tiny disruptions in brain nerve cells that slowly evolve into major neurological problems. The cause is a genetic mutation in the HTT gene, which is inherited and triggers the production of an abnormal protein. Patients typically have a life expectancy of 10 to 20 years after the first symptoms appear, with a recovery rate of only about 5 to 6%. Early symptoms are subtle, such as mild involuntary movements, and the disease most commonly begins between ages 30 and 50. There is no therapy that can stop the disorder, so treatment focuses on slowing its progression and maintaining quality of life for as long as possible. Amyotrophic lateral sclerosis. ALS is classified as a disease with a 96% mortality rate after diagnosis. ALS attacks the motor neurons, vital nerve cells responsible for controlling muscle movement. Its primary causes are linked to a combination of genetic factors, aging, and degenerative processes that weaken the nervous system. The disease progresses rapidly, often starting with mild muscle weakness or small twitches that go unnoticed until they begin to affect major bodily functions such as speaking, swallowing, and breathing. Symptoms develop gradually but become increasingly severe, marked by declining muscle strength, progressive paralysis, and reduced respiratory function. Early medical intervention, such as progression-slowing medications, supportive therapies, and assisted breathing devices, can still extend life expectancy and help maintain the patient's quality of life for a longer period. Alzheimer. Advanced stage Alzheimer's has a mortality rate of more than 97%, as it severely damages the brain, a vital organ, and progresses rapidly in its final phase. The cause comes from the buildup of beta amyloid and tau proteins, which destroy nerve cells and eventually lead to complete cognitive and physical failure. Symptoms include losing the ability to speak, difficulty swallowing, and total dependence on full-time care. The high mortality rate occurs because patients often reach medical attention when the condition is already advanced, and the brain damage is irreversible, leaving treatment focused only on managing symptoms rather than restoring function. Ebola. Ebola can be described as the rapid decline of organs that once functioned normally, disrupted by an Ebola virus infection that causes widespread and severe tissue damage. The process develops in stages. It begins with the initial infection of body cells, followed by mild symptoms, and eventually progresses into serious complications affecting the immune system, blood vessels, and vital organ function, severely interfering with daily activities. This disease appears most often in endemic regions of Africa or among high-risk groups such as healthcare workers and people who have contact with infected animals. The mortality rate of Ebola can reach 90%, and many doctors consider it effectively 99% fatal.